and welcome back to my clinic.
Hi, nice to see you again.
Nice to see you as well, Amanda.
Thank you.
So what brings you in today?
Last time I was here for a back exam, and
Yes.
it helped. I felt better afterwards, but now the pain has it was up here at first in my upper back, and now it's traveled down to my lower back.
Okay, so from the upper back, it is now radiating into your lower back.
And I can't stand it.
Okay. And for how long have you been feeling these new symptoms, Amanda?
Say about 2 weeks.
2 weeks, okay.
I wanted to give it time to see if it would go away.
So I did see you more than 3 weeks ago. And did you feel better after our previous assessment?
Yeah, I felt a little better, but the pain came back and just kind of moved.
Okay. And have you been taking any medication?
Just ibuprofen, Tylenol.
All right. How many milligrams of that, Amanda?
About 600.
600 milligrams, okay. That is definitely a good amount of painkiller for your weight. And have you experienced any blurred vision or double vision with these symptoms?
No.
No blurred vision, okay. Any difficulty breathing?
Mm-mm.
Any tingling sensations in your face, arms, or legs?
No.
No, okay. Sounds good. So what I'm going to do, Amanda, given that the pain has been persisting for so long, is I'm going to do a cranial nerve exam to make sure that all 12 of your cranial nerves are working as expected and that there haven't been any changes since the last time I saw you.
Okay.
And then I'll focus on your back and I'll do a back exam and massage, and I'll focus on your upper back as well as your lower back.
Okay.
And I'll try to get a little bit deeper this time around into those knots that I felt the last time, and hopefully, whatever I wasn't able to relieve last time, we can take care of now.
Okay, thank you so much.
So I'm going to sanitize my hands. Any flu-like symptoms in the last 2 weeks, Amanda?
No.
So I'm going to ask you a few questions to assess your mental acuity. Do you know what day of the week it is?
Tuesday.
Tuesday. And do you remember what you had for breakfast?
Eggs.
Eggs, very good. And do you know who the President of the United States is?
Joe Biden.
Joe Biden, yes, very good. So I'm not concerned at all with your mental acuity. And how would you describe your pain, Amanda?
I would say it's an aching pain, and on a scale of 1 to 10, about an 8.
An 8. Okay, that's good that you came to see me today. Okay, so I'm gonna start off by taking your vital signs first.
Okay.
Is it okay if I slide this under your shirt to listen to your heart?
Yeah.
I'm just going to take your hair out of the way. And just breathe normally for me. I'm going to be listening for any murmurs, any abnormal sounds coming from your heart. So I'm able to hear S1 and S2, no extra sounds, no murmurs, good steady rhythm. I'm going to listen with the bell side as well. I'm going to focus on your lungs next. Take a deep breath in for me and out. Deep breath in and out. Deep breath in and out. Okay, you can just breathe normally now. I'm going to listen to the base of your lungs as well, in the back. Take a deep breath in and out. Excellent. So I'm not hearing anything abnormal coming from your lungs, no signs of bronchitis, pneumonia, infiltrates, or any abnormal sounds. Okay. I'm going to check your temperature next. Okay, so this is going to be just a little bit cold. I do apologize. It's going to go over your forehead and behind your ear. 98.4. Excellent temperature, so you do not have a fever. I'm also going to check your levels of blood oxygenation at room temperature. Your index finger goes right here and just relax for me. Take a deep breath in and out. 5, 4, 3, 2, 1. Excellent. So I'm seeing 74 beats per minute, so that's very good, and about 98% oxygenation. So these are very good vital signs. Okay. I'm going to check your pulse next manually. May I please have your wrist and just relax on me. And I'm going to compare with the one on the other wrist to check if they're synchronized to plus synchronized. Very good. And I'm also going to check the pulse over right here. Not hyperdynamic, not weak, normal. Very good. I'm going to check your blood pressure next. Now, the blood pressure may be a little bit elevated because of the pain. Okay. So if we do see that, there shouldn't be any cause of concern as long as it's just slightly elevated. Okay. This is going to go right here. Okay, you can rest your hand right there. And if you don't mind holding this for me right there. Okay, make sure your legs are uncrossed. And just relax. Hmm. 120/60. So not noting any elevation in your blood pressure, which is very good. How much pain did you say you're in right now? About a 6?
About an 8.
An 8, okay. So that's not concerning at all. I'm going to make a note of those vital signs, Amanda, to make sure that we have a good record, since this seems to be a persistent issue for you. It's good to have a good track record and history of all your vitals. So normal blood pressure, normal temperature, good levels of blood oxygenation. The character of your pulse was normal as well. 75 beats per minute. And good normal temperature. That's very good. So what I'm going to do next, Amanda, is just palpate your head. Is it okay if I come close and touch your head? Okay, just close your eyes for me and just relax. I'm just checking for any lumps or bumps, anything that may have started after I last saw you. Checking the back of your neck as well, the top of your spine. No lumps or bumps. Any tender spots right there? No, very good. I'm going to check your lymph nodes for enlargement. Above your clavicles. Lymph nodes are not enlarged. Can you just look slightly up for me? I'm going to check your trachea. Midline. Can you please swallow for me? Thyroid gland is not enlarged, barely palpable, which is what we want. Okay. Most excellent, Amanda, so I'm not able to feel anything abnormal. Your head is symmetric, no lumps or bumps. I'm going to check your eyes next and your vision. Okay, can you please look at the tip of my nose? I'm just going to check for your pupil response. I'm going to flash my flashlight into your eyes for just a couple of seconds.
Okay.
So look right here. From above and from below and across. Excellent. So your pupils are round and reactive to light. I'm going to try to measure them. So look right here. About 3.5 millimeters. Okay, that's very normal. I'm going to check your binocular vision next. Can you please look into my eyes and mirror me, touch your nose, and continue looking into my eyes. Don't interrupt the eye contact and touch my finger with your finger, with the finger that's on your nose. Good. Now back to your nose. Now touch my finger, back to your nose. Touch my finger, back to your nose. Finger, nose, finger, nose, finger, nose, finger, nose. That's harder. Finger, nose. Excellent. Continue looking at the tip of my nose. And now look at the light. Very good. And now just follow the light. I'm going to check if your eyes are moving in a synchronized fashion. Any double vision right here?
No.
How about right here?
No.
Okay, very good. So I'm not concerned at all with your binocular vision. It seems to be intact. Can you please cover one eye for me? And tell me if I'm moving my left fingers or my right fingers.
My left.
Yes.
My right. Both.
Excellent. Now can you please cover the other eye? And we're going to repeat the same test.
My left. My right. Both. My left. My right. My left. Both.
Very good. So the cranial nerves that control the eye movements seem to be intact. I'm going to focus on your ears next, then your nose, then your mouth.
Okay.
Have you noticed any abnormal sounds recently? Any tinnitus? Any? Okay. So I'm just going to palpate your ears. You can just close your eyes and just relax for me. Just feeling for any lumps or bumps. Any any tenderness, Amanda, while I pull down on your ears?
No.
How about when I pinch up?
No.
Laterally?
No.
Okay, could you please look over to your left side for me? Just going to inspect the outside of your ear. Not seeing any abnormal colors, no bruises, no lesions, no discharge. The auricle of the ear has a normal color. No external discharge. Okay, I'm going to take a look inside your ear and visualize your eardrum. Just relax for me. Tympanic membrane is pearly gray, well-defined margins, no abnormal discharge. Most excellent. Okay, I'm going to do the same over on the other ear. Okay, I'm going to just inspect the outside of your ear. No discharge. Normal color. No abnormal colors. Okay, I'm going to take a look inside your ear canal. I'm able to visualize your eardrum. Pearly gray, no abnormal discharge. No indication of cerebral spine fluid leaking in your inner ear. No signs of any infection or inflammation. Well-defined margins. Excellent. Alright, Amanda, so the inner ear, your eardrum seems perfectly healthy, no signs of any abnormal discharges. So I'm not concerned at all with the cranial nerves that control your inner ear. I'm going to focus on your nose and your mouth next. Okay. I would like to see if you can still smell normally. So I have here a very particular essence. Can you please try to identify the smell?
Smells like rubber.
Rubber. Very good. That is excellent. Now can you please obstruct one of your nares? Now I'm going to give you another smell and let's see if you can identify this one.
Bleach.
Bleach. This was peppermint actually. So okay, let's try again.
Okay.
Can you please obstruct the other nair for me? And let's see, maybe we just, had a bad luck there.
I still smell bleach.
You still smell bleach? This is supposed to be lavender. Okay, let's continue the exam and I'll make a note of this mentally and then we'll circle back on this. And one last smell.
Dirt.
This is supposed to be coffee, Amanda. Interesting. Okay. So a little bit of a red flag there, but we'll get to the bottom of this. I'm also going to take a swab of your nose. We do this with every patient that comes to the clinic just to make sure that there are no infections that go unnoticed that we should treat. Is this okay?
Yeah.
So this is going to be just a little ticklish. Excellent. And another sample. Excellent. So I'm going to send this to the lab. And I'm actually going to put in an expedited request, given the fact that you had trouble identifying a couple of my smells there.
Okay.
And we'll get the results before the end of today.
Okay, thank you.
I'm also going to give you something to taste, and I'm going to check the cranial nerve that controls your taste. So this is a very peculiar taste here. Let's see if you can identify this.
Grass.
Grass. That's right. Okay. So that all checks out. Let me just take a look inside your mouth as well, the back of your throat, to make sure I'm not missing any signs of infection. If you can just stick out your tongue for me. Normal color. Just going to look in the back of your throat. No signs of any inflammation. Teeth are intact. Okay, no concern whatsoever, Amanda. That looks perfectly healthy. So the only potential red flag right now is with your sense of smell.
Okay.
So let's go ahead and check the rest of the cranial nerves that control the movement of your face and your neck. Can you please look at me and open your eyes wide and close them tight? I'm going to try to open them. Don't let me do that. Very good. Now raise up your eyebrows for me, all the way up, and keep them like that. I'm going to attempt to lower them. Don't let me do that. Excellent. Puff out your cheeks for me. Keep them puffed. Don't let me unpuff them. Very good. So that works perfectly. You can unpuff them now. I'm going to try to move your head left and right. Don't let me do that. That's good. Good. I'm going to try to push your head back. Don't let me do that. Oh, excellent. And I'm going to attempt to bring it forward. Don't let me do that. Excellent. And finally, can you please shrug your shoulders up for me? Shrug them up. Keep them raised. Don't let me lower them. Excellent. Can you squeeze my hands, please? Tight, tight, tight. As tight as you can. Excellent. Can you do the okay sign for me, Amanda? I'm going to try to pull through. Don't let me do that. Very good, strong. And spread your fingers wide for me. Keep them spread. I'm going to attempt to bring them together. Don't let me do that. Excellent. Very good. All right, so no red flags whatsoever with the rest of your cranial nerves. Let's go ahead and inspect your back, and I'm going to really try to work the muscles this time and try to get rid of all those knots that are in there that are causing you all of this pain.
Okay.
Just doing a visual inspection of your back, looking for any abnormal colors, bruises, lumps. Going to inspect your spine next. Starting with your cervical spine. Any pain right here?
No.
And moving down to your thoracic spine, which is very straight, not noticing any lumps or bumps. And inspecting your lumbar spine as well. Any pain when I press down on your spine?
A little bit as you get farther down.
Okay, so the pain is mostly here in your lumbar area. Any pain on your left scapula right here?
No.
And how about right here on your right scapula? Your spine is very straight. Alright, Amanda, I can get dressed now.
Okay.
Alright, Amanda, so how do you feel now?
I feel a little better.
A little better?
Yeah.
Okay. I'm happy that I was able to help you.
Yeah.
So I did a very thorough back inspection and massage, and I was able to feel some of those knots that are still persisting. And I think I got rid of most of them, but you may need a follow-up.
Okay.
So I'd like to see you back in a week.
All right, sounds good.
Awesome. All right, Amanda, see you soon.
Okay, thank you so much.